What does it mean for the vaccines to be approved for emergency use authorization?
They go through the same scrutiny. What we've done is eliminated a lot of the red tape and paperwork that is commonly associated with approval of new medications. But the science is there. They've been studied in tens of thousands of people in the studies that were submitted to achieve the emergency use authorization.
Great. All right.
So that we didn't cut corners on the quality. We just got rid of some of the paperwork and administrative hassles that governmental processes sometimes put in our way.
Why should healthy people get vaccinated?
Well, the simple answer is that healthy people are vulnerable to catching this virus, and thousands of them have, and unfortunately, many thousands have died. It does not target by age or race. I've seen and treated patients who were previously in excellent health, who've been admitted to the ICU and are still suffering long-term complications of the illness. And indeed, I saw a 21-year-old yesterday who was admitted last week, was in the ICU for 3 days, and is clearly very sick, and it's going to take a long time to recover.
What is your stance on recommending a vaccine for someone who has already had COVID?
It is recommended that people who have had an infection with COVID still get the COVID vaccine as an additional boost to their immunity to protect them from getting it again.
We do think that most people who have a COVID infection have some degree of immunity, but we don't believe that that is going to last as long as the immunity that comes from the vaccination. So we do recommend and encourage people, even if you've had COVID, to get the vaccination.
How do the vaccines affect maternal and child health? And specifically, could you speak to fertility and pregnant women receiving the vaccines?
And what we know from all of our experience with the vaccine so far is that it does not have any adverse impact on pregnancy or on fertility from what we know so far. But moreover, understanding how the vaccine works, there's no reason to think that it might have an impact on fertility, as opposed to the risk of the infection for a pregnant woman. If they get a COVID infection, that can have very serious impact for the woman, for their unborn child, for the pregnancy.
What's the risk of getting infected with COVID-19 after someone gets vaccinated?
You're considered fully vaccinated 2 weeks after you've had your last dose of the vaccine, whether it's a second dose of the Moderna or Pfizer or the first dose of the Johnson & Johnson. And then once you've reached that point, depending on what you're looking at as far as the studies go, your risk of contracting the virus is greatly reduced to the tune of 95% or better in most cases. And then your risk of, as was said earlier, your risk of hospitalization, ICU, intubation, death is much, much greater reduced.